Spacer means more medicine in your lungs, but many of us puff fast and hope for the best. The truth is, slow, steady steps make a big difference. I'm Alex, and after a scary flare in my family, I learned the right way the hard way. Welcome to Breathe Better with Alex. Asthma and Lung UK says using a spacer means more of the medicine gets down into your lungs. Geeky Medics adds, spacers improve drug deposition in the lungs. That's why this method helps you feel relief faster. Here is the plan we'll follow. Prepare, seal, inhale, hold, and aftercare. Clear steps. Calm breath, better results. Quick safety note, this video is education only. If you have severe breathlessness, blue lips, or can't speak full sentences, seek urgent care now. Speed tip. Before we start, remove both caps and shake the inhaler for about 5 seconds. That simple mix makes each puff even. Today I'll show you the exact steps I use at home. Slowly, so you feel confident. Did your clinician ever show you spacer technique? What did they teach or maybe miss? Okay, what's the first crucial step? Let's prepare the device the right way. Step 1, get the device ready. Many people skip priming or forget a simple shake, and that wastes medicine. I used to do that too. Here's the fix. Wash or sanitize your hands. Take off both caps, the inhaler cap and the spacer cap. Check the spacer for cracks, dust, or anything inside. If your spacer has a valve, make sure it sits upright and moves freely when you breathe. Asthma and Lung UK puts it simply, shake it well. So shake the inhaler for about 5 seconds to mix the medicine with the propellant. If the inhaler is brand new or has not been used for about a week, prime it. Many devices need 1 to 2 test sprays into the air away from your face. Check your device leaflet for the exact steps. Attach the inhaler to the spacer firmly so there are no leaks. If your inhaler has a dose counter, peek at it so you know how much is left. A solid prep means the first puff hits full strength. Ready? No prep matters if you don't set up your breath. Next, we empty the lungs and seal the lips. Step 2, empty your lungs first. Many of us inhale too soon, so there isn't room for the medicine to travel deep. Sit or stand tall, relax your shoulders, breathe out gently and fully, away from the spacer until your lungs feel empty. Asthma and Lung UK says it just like that, never blow into the spacer. Now place the spacer mouthpiece between your teeth and form a tight lip seal around it. Keep your tongue down and out of the opening so the flow is clear. No gaps, no leaks. This seal keeps the medicine where it belongs, going into you, not around you. If your mouth is dry, a small sip of water before use can help you make a comfy seal. This step looks simple, but it is powerful. Empty lungs make space for fresh air and medicine to reach the small airways. That's the goal. You've set the stage. Next comes the key timing move that most people get wrong at first. We will press once and breathe in slowly. Step 3. Press the canister once and inhale slowly. This is where timing matters. When you press, a cloud sits in the spacer for a moment. You need to draw it in with a gentle, steady breath. Asthma and Lung UK advises, press the canister once and breathe in slowly until your lungs feel full. Aim for about 3 to 5 seconds of smooth breath in. If your spacer makes a whistling sound, you are breathing in too fast. Geeky Medic says if the spacer whistles, breathe more gently. That whistle is your built-in coach. Slow it down. 1 press equals 1 slow, deep inhalation. Not 2 presses, not rapid sips. Watch the spacer valve move as you inhale. That motion confirms the flow is right. If you need a pronunciation tip, metered dose inhaler is often called MDI. I say the letters out loud, MDI. You're doing great. You've drawn the medicine deep. Now give it time to land in your airways where it can help. Next, we hold the breath, then exhale softly. Step 4, hold your breath. Many of us breathe out too soon and send the medicine right back out. During a calm pause, those tiny particles settle onto your airways. Asthma and Lung UK says to hold your breath for up to 10 seconds or as long as comfortable. I like to count slowly in my head. If 10 feels hard, try 5 or 6 and build up with practice. Keep your chest still if you can. Then breathe out slowly and gently, away from the spacer. No rush. If you cough, reset and try again when you feel ready. Holding for a few extra seconds can make a big difference in where the dose lands. This step helped me the most during tough seasons because it feels like a small win you can control. You have completed 1 full puff the right way. Exhale, seal, press, slow inhale, hold, and gentle exhale. If you need another puff, Don't rush it. Give your lungs and the spacer a moment. Next up, how long to wait before the next puff. Step 5. One puff at a time. Many people rush the second puff and weaken both doses. After your first puff, remove the spacer from your mouth. Wait about 30 to 60 seconds. Shake the inhaler again to remix the medicine. Then repeat the same steps. Exhale fully. Seal the lips. Press once. Inhale slowly for about 3 to 5 seconds. Hold and exhale gently. Asthma and Lung UK advises waiting 30 seconds to a minute, then shaking again before the next puff. That pause lets the first dose settle and clears leftover mist in the spacer so the second can work well too. I set a quiet count in my head or watch a second hand. Quick mid-video ask, if this step-by-step helps you breathe easier, please like the video and subscribe to Breathe Better with Alex for simple weekly breathing tips. Okay? We have the timing down, now let's protect your mouth and throat if your inhaler contains a steroid. That small rinse can save you a lot of irritation. Step 6. Rinse and spit after steroid inhalers. Steroid sprays can coat your mouth and throat. Leaving that residue can lead to irritation or a yeast infection called thrush. Asthma and Lung UK recommends that if you used a steroid inhaler, rinse your mouth with water and spit it out. It takes a few seconds and helps prevent side effects. For children, offer sips of water and have them spit if they can. If they are very small, a few sips and a spit after is fine. If you are not sure whether your inhaler has a steroid, check the label or ask your clinician. This channel is educational only, not medical advice. I rinse right at the sink before I put the cap back on so I never forget. Hydrating after treatment can all soothe a dry throat. Easy habit, big payoff, mouth clean, device capped, you're set. Next, what if a tight lip seal is tricky or you are helping a little one? We'll add a mask and switch to calm, normal breaths. Step 7, use a mask when a lip seal is hard. Young children and some adults with limited mouth control may not be able to seal around the mouthpiece. That is okay. Attach the spacer mask and fit it gently over the mouth and nose. Make a soft seal on the cheeks. Press the inhaler once. Then have the child breathe in and out normally through the mask for about 4 to 6 slow breaths. This is called tidal breathing, said like tidal breathing. Watch the spacer valve open and close with each breath. That motion helps you count. Keep the pace calm. Most children switch to a mouthpiece by school age when they can seal their lips. If the mask or spacer whistles, breathe more gently. You still want that smooth, steady flow. This approach has helped a lot of families I work with, including my own. When the technique fits the person, the dose can finally do its job. Mask success checked. Let's keep your spacer clean and ready for next time. Step 8. Clean and store your spacer the right way. Over time, plastic builds static and traps medicine on the sides. A simple wash fixes this. Use warm water with a small drop of dish soap. Gently swish and let it sit a moment. Do not scrub. Let it air dry fully. Do not wipe it with a towel. Geeky Medics notes that wiping creates static and drug particles will stick to the sides. Many guides also suggest leaving a thin soap film on the inside to reduce static. If you use the spacer daily, wash it about weekly. At minimum, clean it about once a month. Store it in a cloth bag, not plastic, to avoid static buildup and keep it away from heat. Check for cracks and replace about yearly. For inhalers with dose counters, trust the counter. If it reads 0, it is empty. Do not float test. If there is no counter, mark the start date and track puffs per the device instructions. A clean, low-static spacer means your next puff reaches you, not the plastic. Last, let's avoid the usual mistakes. Step 9. Common mistakes can ruin your dose, but they are easy to fix. Breathing in too fast makes some spacers whistle. That means slow down. Not shaking the inhaler each time can weaken the spray. Forgetting to prime a new or long unused inhaler leads to a weak first puff. Pressing multiple puffs into the spacer before you breathe wastes medicine. One press, one slow breath, one hold. Not exhaling fully before the puff or letting your lips leak around the mouthpiece also cuts delivery. Skipping the rinse after a steroid inhaler can cause mouth irritation or thrush. Rushing puffs back to back without waiting 30 to 60 seconds reduces how well the second puff works. 2 quick safety flags. If you need your reliever more often than usual or your breathing is getting worse, talk with your clinician. If you have severe trouble breathing, blue lips, or can't speak full sentences, call emergency care now. If coordination is tough during a flare, some people use a portable mesh nebulizer. I linked one from TruNeb.com in the description. Now, let's bring it all together. You now know every step of using a metered dose inhaler with a spacer. Prepare, seal, inhale slowly, hold, rinse, and clean. This is the real technique that gets more medicine to your lungs and cuts side effects. I built these steps after struggling with timing myself, and they helped my family stay calmer during flares. Quick recap checklist on screen. Wash hands, remove both caps, shake for about 5 seconds, prime if needed, check the spacer valve, exhale fully, tight lip seal, press once, breathe in slowly for 3 to 5 seconds, hold up to 10 seconds, exhale gently. Wait 30 to 60 seconds between puffs, rinse after steroids, wash and air dry the spacer, store in a cloth bag. Thanks for watching. If this helped, please like, share with someone who needs it, and subscribe for more practical breathing tips. Always check with your clinician for your personal plan. Thanks for watching, truly. Which step will you focus on mastering first the next time you use your inhaler?